The next test we're going to do is the slump test. So this is again our neural testing, and Glenn's going to go through the slump on PJ. So yeah, off you go.
So what I like to do, start position, we're going to ask PJ in this instance to flex forwards for me, so have a really poor posture. First time physios are going to ask you to do that. So pop your hand behind your back and hold that position. And I'm going to take my hand and just rest it over here. Now, I'm not a big advocate of forcing and putting overpressure through. This is just feedback, tactile feedback for PJ, so that he knows if he's going to be pushing back through his head or if he's going to try and extend his thoracic spine. The thoracic spine is really important. That's the part we want to keep on, especially when we do the sensitization aspect. So are you okay in that position?
I'm fine.
And you check each stage as well. I think that's quite important. Now, for the basis of the video, we're going to say that PJ's got an issue on his left side. So try and just straighten out that left leg for me as far as you go. Okay, and he's hitting a bit of a restriction there. Now what we can also do is I'm going to lift my hand, straighten out your head for me. Okay, does that change it? And I'm keeping my arm there to stop the thoracic flexion from coming off and back down. Yeah. Lower the leg again for me. The other thing we can do, this time I want you to pull your foot up into dorsiflexion. Hold that point and now straighten your leg for me, and you probably get a little bit less movement there. He's stretching out there. And from here, head, does that change? And then ankle.
So plantar flexing through the ankle and then seeing whether that creates any more range of motion. Same thing with the head, and all the time just asking about symptom provocation. Does it produce their symptoms? Again, a lot of people are going to feel stretching doing this, but it's important to differentiate or make the client differentiate between are they feeling their pain or are they just feeling a stretching pain? And obviously, like all of our tests, we want to compare one side to the other side.
Yeah, I mean, bear in mind as well, the area that you're getting your pain in is going to strongly influence what sensitizing aspect you use. You want to have at least a joint in between. So if you're getting calf pain, it's no good using the ankle plantar flexion. You have to use the head. If you're getting lower back pain, I'd probably use the ankle. So you kind of modify it to your client's presentation.
Yeah, and that's because, so just explaining that's because obviously if you have calf pain and use the ankle, you've got a lot of soft tissue structures around there that could be potentially causing an increase in that pain. So you want to make sure that, like Len said, the joint between stops it from you getting false positives where you think, oh yeah, that's increased symptoms, but actually it may be that there's some soft tissue damage down there that's being stretched when you're doing that, which is increasing the symptoms, but it's not actually necessarily a neural issue. So yeah, I think that's a really important point. Cool.
Sometimes even two joints. I mean, if you think the calf attaches above the knee,
absolutely.
Yeah, so I'd go straight to the head there. Even if we were getting posterior thigh pain, I wouldn't use the ankle. Yeah, so you just bearing in mind your anatomy of your muscles and soft tissues.
Yeah. And then if we want to test sural nerve, the obturator nerve as well, because we can do that in sitting, can't we?
Yeah, I use this position, but I'm just going to ask PJ to shimmy across to the side so that the corner of the bed is in between. Yeah, and I'm going to get you to just sit back a little bit more for me there, so you've got a bit more support on here. Okay, same setup. Yeah, so slump down for me, really poor posture, hands behind your back, arm and hand position in exactly the same place. Yep, so what we can do now is straighten the leg for me and back down. And now for the basis of the camera, I'm going to change his problem over to the right. So straighten that right leg for me. Okay, that's the position there. Again, you can use the head, so we're seeing is that changing it at all. That gives you a little bit of information. So if we want to emphasise the obturator nerve, I'm going to bring him out into a bit of abduction. Try and keep that knee extension the same for me. Does that make it stronger or less? Usually it would be stronger. But then we want to differentiate, is it adductor muscle strain that we're increasing the pain with, or is it a nerve, obturator nerve specifically? So now if we've increased the pain, we're going to do the same with the head.
Yep.
Yeah, and back down. You can also use a bit of internal rotation as well, same thing with the head here.
And again, down. you could potentially do that abduction before you did the straight leg raise as well, couldn't you? You could do that first, do that abduction, and then do your straight leg raise. Again, sometimes people, just by doing that abduction, they might feel a stretch.
Yeah.
And if that was the case, you wouldn't necessarily then do your extension of the knee. You just do your head flexion extension to see whether the symptoms changed. Because obviously, if you've already wound it up a little bit, then adding that could be irritating, basically. So again, you can, and if it wasn't changing it and wasn't irritable, then you could do the extension as well.
I mean, we keep coming back to these sin factors, don't we?
Yeah.
So your severity, your irritability, your nature, it's always key. That's why I emphasise a very in-depth subjective history-taking process, because perfect example there, if PJ was very severe and very irritable, I would have done that in a different order.
Yeah.
So you'd put the test on first, like you say, and just slowly work into it. If you're really searching and it's quite a vague pain and it's very low irritability, it eases off the minute he stops doing his aggravating activity, then it's fine to do it how we did. So it's independent to each client, and as long as you're noting it down and you've established your appropriate sin factors, then you can usually gauge it appropriately.
Definitely, and yeah, like we've said on the other videos, get used to doing these tests as standard first, and then start to think about how you would then modify them for different types of client who came in. And as Glenn said, using your severity factor, your irritability factor, then how would you modify the position maybe in order to still get the same result of the test, but with a less or more irritable type position that you're going to put them in. So yeah, I think that's really good point.